My name's Colin, a consultant cardiologist in the Golden Jubilee National Hospital, Queen Elizabeth University Hospital in Glasgow, and also Professor of Cardiology and Imaging in the University of Glasgow. I would like to describe the e-registry that we have developed focused on patients who present with a heart attack to hospitals in Glasgow. We are interested in trying to bring together the patient journey, if you like, the patient experience for a patient who has a heart attack, who is admitted to one of the hospitals in Glasgow. The pathway of care can involve transfer between hospitals, sometimes 2 or 3 hospitals, and it can be challenging for clinicians to track the patient journey, to understand about the outcome of their patient. And that's just for one individual patient, but in fact, thousands of patients with a heart attack are admitted to hospitals in Glasgow each year, and indeed almost 20,000 patients may be admitted to hospitals in Scotland overall. So this is an important public health problem, and heart disease and heart attack are leading causes of death and disability overall. So focusing on this, we wish to exploit electronic patient records using a unique community health index, the CHI number, which allows independent databases such as for prescribing, such as for the admission record, such as for referral for a coronary angiogram or referral for bypass surgery. All of these systems sit independently, but by using the CHI number, we can bring together the episodes of care and the components of data into one database. And this is all done through a process which is oversight on governance, where the identity of the patient actually can be removed, and that's enabled through the repository called an NHS Safe Haven. And then by charting individual patient journeys and bringing them together, we can learn so much more about how our patients are, how they present, the different journeys. There's 6 pathways actually, how they're treated, their treatment times, the treatments they do not receive, and then their outcomes through to 1 year and indeed longer. And we've learned some interesting information about differences in how women and men present with heart attacks, how their outcomes differ. We are learning about the importance of socioeconomic factors in presentation and indeed treatment. So we've achieved this project through a multi-partner initiative: the Golden Jubilee National Hospital, the Queen Elizabeth University Hospital, the Scottish Government through Data Lab, the University of Glasgow, including the Robertson Centre for Biostatistics, health science, and also a partnership with industry, AstraZeneca, which is a pharmaceutical company which is seeking to support real-world evidence in clinical practice. And this project was instigated effectively by the Scottish Government and an initiative proposed by the First Minister Nicola Sturgeon some years ago. So we reported our results at the Scottish Parliament yesterday, on the 14th of May. We're excited about the results, and we now hope that not only will this project continue in Greater Glasgow and Clyde, but that it can extend across the regional boards in the west of Scotland, and also nationally in the other boards such as in Lothian, Tayside, Grampian, the Highlands and so on. Such an e-registry will help us get a national picture, and actually will be enabling in other ways to support new research initiatives, to bring in life sciences and effectively create jobs. So there are many potential spin-off developments, but with the underpinning premise of trying to bring together patients' health information to drive improvements in clinical practice and their well-being.